Our next, and I'll get you to hold questions just to the end. So our next speaker is Dr. Kirsten Baulch. Kirsten joined the board of the Innovation Centre earlier this year. She's a general practitioner with over 16 years experience in clinical, medical and business, and is the founder and medical director of Medimobile, a Queensland-based company. Award-winning nationwide workplace and community influenza vaccination service. Kirsten is a passionate advocate of using innovation IT systems as a means for the entrepreneur to create an enterprise that delivers an efficient, consistent result. She enjoys showing how applying innovation systems in traditional sectors can allow aspiring entrepreneurs to create the business and lifestyle of their dreams. So the theme continues. Thank you.
Well, thanks for coming along to the Innovation Centre today. And when I was invited to present on this topic, I got really excited because this is one of my favourite things to talk about, which is how can entrepreneurs innovate and really create something really wonderful, compliant, but also really cool in what is a very traditional sector. So I'm really excited to be here today. 3 weeks ago, Ernst & Young released their Entrepreneurship Barometer, which is a survey of 1,500 prominent entrepreneurs from around the world. And the vast majority of those entrepreneurs surveyed said that the sharing of success stories in entrepreneurship was the most impactful way of inspiring entrepreneurship. And so in that spirit, I thought I will capture my story for those of you. It has been, I mean, it's a work in progress, but it's been a success really beyond my wildest dreams to this date, and it's just been such an incredible journey. And then I'll then go on to talk about the e-health space and health IT in general. And then at the end I'm going to conclude with some tips for the aspiring entrepreneur, which are tips that can apply for anyone wanting to get involved in their own startup. But there's also a few things in there that you really need to be conscious of when you're working in this space, and where everything needs to be done very well. And I'm also going to talk about some pitfalls, and at the end I'll give my email address there for those who want a copy of the slides emailed or to contact me for any reason. We can send those on to you. So I know not everybody here is ready to start their own company, or you're working around the sector, but the talk is really aimed at that kind of mindset of the person thinking of starting a business or who's begun the journey and wants to know how they can really accelerate their growth. So my path to entrepreneurship began, I went to school on Bribie Island and graduated there at Bribie Island State High School, and was fortunate to receive an offer at UQ Medical School. And so straight out of school I moved down to Brisbane and studied medicine, and 7 years of some good sort of long hard study, and I came out of that and spent a few years in Queensland hospitals, and afterwards ventured into the world of general practice. And while I was an intern, I really enjoyed working in medicine and traditional segments of medicine, but I was inspired to undertake some business studies at night while I was working in the hospitals and at QUT, and I enrolled in their MBA program, and I attended a forum one evening, much like this one, where some entrepreneurs came and spoke to us. Some people from one of the incubators in Brisbane came, and that was a real turning point for me, sitting in an audience much like this one. And I walked out of there determined that I was going to start up a health business in something a little bit different, something entrepreneurial, but I really wanted to become the master of my destiny. So I walked out of there pumped and ready to go on this path that some of the entrepreneurs had been on, and I just thought it sounded wildly exciting and really fun, and so off I went. There's different reasons why people choose to start their own business, and they're as varied as the individual, really. But early on in the piece I decided I needed to figure out why I wanted to do this. I had a bright career ahead of me. I enjoyed my work, but something in me was just fascinated with business and what could be achieved that was far greater and bigger than myself. So my 6 reasons were I wanted freedom, and I wanted the freedom to create and mould something interesting, large, dynamic. I was 24 at the time, so I also wanted to do something cool and something enjoyable. I wanted flexibility, so I was doing the horrendous night shifts and you know, they work you to the bone as an intern, and I thought I would actually prefer to work when I wanted, how I wanted, where I wanted, and maybe that's the Gen Y in me, I don't know, but it's just innately what I felt constrained in being told where I had to be and what I had to do, and I wanted also the flexibility to work when I had high energy and rest when I had low energy. And a lot of entrepreneurs are like that it's this incredible creative force that you have, and you might work all through the night because you're in that flow zone, and then you need to rest. But I found that the usual workforce didn't really cater to that style of working. I wanted financial independence, so I wanted to be free to really live where I wanted, and now I'm living at Noosa, but the business is in Brisbane, but most of our clients are in Sydney, and it's so much sort of beyond where we actually are. And really to radically, dare I say it, be able to earn sleep money, where not only did I have personnel out there working for me, doing a great job, following all the systems I'd set up for them to follow, but perhaps I could earn money while I was sleeping, and the idea of that really excited me. Of course, I wanted to have fun, and the heart of me is also about, you know, as a humanitarian, is about philanthropy and giving and doing something to help those who are in desperate need. So I thought if I could create something that could generate funds that I could share with parts of the world that need it, that would give real meaning and purpose to what I was doing. So I had a fire in my belly, and I needed to find an outlet for it. And once I was on this journey and I walked out of that seminar, there was really no turning back. So about my business, so in 2003 then I started Medimobile, which is a workplace flu vaccination service. We've been operating in all Australian states and territories for 10 years. And I now employ 274 nurses and 6 doctors, and we vaccinated this year 184,000 patients against influenza in the workplace setting and in pharmacies in the 11-week period leading up to winter. So it's very seasonal. There's this incredible peak with large amounts of personnel involved, and then it goes down into a very quiet phase that we're in at the moment, where we create and plan for the next growth wave, the next season. So our clients are businesses, small businesses right up to major banks and airlines, small segments of government departments, and then right up to national contracts that you get for Defence Department and so forth. And they pay for us to send one of our nurses into their workplaces so their staff can optionally sign up to for a flu vaccination should they want to, without the inconvenience of going off to their general practitioner. So the staff are really only needing to invest about 2 or 3 minutes of their time, as opposed to the on average 1 or 2 hours that it would take them to access that service if they went to their GP. With the name, I originally started out thinking I would offer to corporations the full suite of mobile medical services, and I would have a team of doctors that went around to very time-poor executives and so forth and became their personal doctor. But when I went out and started cold calling businesses in Brisbane, it was in the year 2000, what they were talking about was flu vaccinations, and it was following on from a trend coming out of the US that is well established there, that workplace flu vaccinations were just commonplace. And the point that we sit at now, there's only one major corporation in Australia that doesn't offer this, and almost every government department does as well, so it's become quite normal here. It's based in Brisbane. I'm living in Noosa now, but as we've developed, we've been able to employ a fabulous CEO and a great team, and seasonally we have about 30 administration staff in our premises in Brisbane. And myself and my business partner, who's also my husband, we work from home or wherever we may be, and wherever we can get internet, we can control the part of the business that we need to, but we're really mostly now at a strategic level and spending most of our time on IT as it would happen. So I think one of the reasons that we've been successful and really left our competitors behind and been able to acquire them and grow to the stage that we have is we've always spent a lot of money on IT and got developers in to develop our own piece of software because there's really nothing quite like Medimobile that we found anywhere in the world. So there's lots of businesses that offer executive medicals to companies and medical services to companies and do a bit of flu vaccinations on the side, but none of them focus exclusively on flu. So there was no piece of software off the shelf, and there still doesn't exist. And even when I liaise with our counterparts in the US and the UK, nobody's aware yet that something like this exists. So it's probably cost the price of a house to build the thing, and we're still spending a lot of money on it, but it's really the secret to how we grow and how we manage things and offer a very consistent, reliable service to our customers and to all of our nurses without the guesswork and without things falling through the cracks. And when your entire year's turnover is transacted in an 11-week period, you really need to get it right. You can't afford for anything to break or to go down. So it's an enterprise piece of software that allows us to do all of our customer relationship management, our marketing, our invoicing, ordering from our suppliers, following up for customer satisfaction, and integrates all of our human resources. So with all those nurses, we need to make sure that they're all properly checked and CPR is up to date and all of those types of things. So it's brought all of that into to one system. And I really believe it's this focus on systems and IT and getting the best developers that we can that has enabled us to really eclipse the competition and be in a position now to expanding into New Zealand next year, but still coordinating it all from our premises in Brisbane. We found we haven't yet needed to set up offices elsewhere, and when we're seasonal and our building is empty half the year, we really can't afford to. So we've really had to find ways to offer a service no matter where you are around the country or now across the oceans that people can rely on. So it's going from our early years we were vaccinating just a few thousand people and building our software as we went, and at 2008-9, which is when my husband sold the business he was in and came over to assist me. It gave us an injection of funds that we could put into taking our software to the next level that it needed to be. And we've been honoured to receive Telstra Business Award in the early phases and just growing and growing and growing, and being listed on Business Review Weekly's fastest 100 growing companies in Australia for 3 years, and really almost feel like we've just begun, and really starting to attract the attention of buyers and purchasers, and really looking forward to being in that place of having a bit of a bidding war. But we turned down offers because with the way technology is evolving, we're still excited about what we're doing and still see a lot of potential. So currently, my partner and I are almost exclusively focused on the things that IT can offer to our business, to our patients and to our customers. So we're currently rewriting our software to get it up so it's cloud-based, so we can offer it to businesses like ours around the globe that want to be able to buy something like this off the shelf. We've actually commissioned the App Factory here in the Innovation Centre to write our patient app all around colds and flus, and they're also writing for us an app for our nurses. There's a trend with employees really wanting empowerment, just like patients want empowerment, but they want to control their HR information. They want to be able to easily see what their entitlements are, upload or just photograph their CPR certificate and upload it, and some of those conveniences. So 2 apps in the development, a training portal for the nurses and the video logging so that we can communicate with our patients and nurses who prefer to receive information in video format rather than written format, which I have learnt from Matt, a trafficker, that I think it's about half of people will prefer to watch a video of a talking head saying something than reading it. And if it means the difference between them actually taking in the information, then we consider it's worth investing in. And the endless evolution of social media and the importance of that in business.